I'm going to do a short tutorial on respiratory histology, and I'm using the images from the websites that you were required to visit, which were JDoc HistoWeb and the Lumen website. Let's begin by looking at the images of the trachea. Now on your right you see a trachea with only part of the lumen showing. You see the epithelium, you can look at the cilia. What you also see is the hyaline cartilage. On the left is an image of the bronchus, but it could well be that of the trachea because again you do not see the entire lumen. And what is different about this image is you are seeing some glands present, which is seen in the submucosa. Let's now move to the next set of slides, which are those of the bronchus. Now in the bronchus, if you look at both the right and the left images, you can see an entire lumen, you can see cartilage plates, and in the left image you also see some glands in the submucosa. Let's now move to another slide of the bronchus from a different view, where we are not looking at a number of cartilage plates. Instead, we only see a few. So on the right image up there, you see a rather large bit of cartilage, and the presence of this cartilage would identify it as a bronchus. On the right image again, on the top, you can see a cartilage bit. You can see a complete lumen, and you can also see a branch of the pulmonary artery. Remember, the pulmonary artery always follows a bronchus. Let's now move on to a bronchiole, and we identify it as a bronchiole when there is no cartilage at all. Now you see an uninterrupted lumen lined by epithelium. And on the right image, you are also seeing a lymphatic nodule. On the left image, you do not see a lymphatic nodule, but you can see a complete lumen, a round structure. You see a good bit of smooth muscle surrounding it, and you see two branches of the pulmonary artery. Moving on to another slide of a bronchiole. You see a small bronchiole in the right image and a larger one in the left. But again, in both these images, what you notice is that the lumen is complete, the lining is not interrupted, and you have a good coat of smooth muscle surrounding the lining. Notice the little arteriole below the bronchiole in the left image. From the bronchiole, whether you call it a simple bronchiole or a terminal bronchiole, we will move on to respiratory bronchiole. But before we do that, let's look at how the pattern moves from terminal right up to the alveoli. A terminal bronchiole gives rise to a respiratory bronchiole, and if you notice the alveoli budding off from it, this will tell you that the lumen lining will be interrupted. A respiratory bronchiole then moves to an alveolar duct, which will move to an alveolar sac, and the alveolar sac then has a number of alveoli branching out from it. Think of the alveolar sac as a cluster of grapes and each alveolus as a single grape. Now let's look at the histology of a bronchiole, a respiratory bronchiole. And again, when you look at both these images, the right and the left, what you see is a terminal bronchiole up there, and that is leading to a respiratory bronchiole. The reason you see this terminal bronchiole is because the slide has been sectioned in a longitudinal fashion. The respiratory bronchiole shows an interrupted lumen, an interrupted lining, and you can see alveoli budding off from the side. In the right hand side image, notice a huge bronchus on the top where you can see bits of cartilage. Let's finally look at alveoli. The right image where you can see the label showing E, that's an alveolus, and next to it is another one, and the little line in between is the interalveolar septum. In the left image, you notice a blue arrow pointing to the type 1 cells of the alveolus, and the green arrows point to type 2 cells which are responsible for production of surfactant. Now, having looked at all these images, I would suggest that you rewind and look at them once again so that you're completely familiar on how you would identify a tracheal slide from that of a bronchus, from that of a bronchiole, a respiratory bronchiole, and an alveolus, so that by the time you take your quiz, you're really clear about these structures.